etiology begins to affect cancer care right from the point of prevention, where it begins to become hard to ask patients to make behavioral changes that can impact their health, like being more active outdoors, like being sure to follow up and keep their appointments for screening when their environment is not allowing them to keep those commitments. We're seeing more heat waves. The last summer was the coolest summer that we will ever know, and it was a beast. So we're just going to see hotter and hotter environments, particularly in marginalized communities with low resources. For example, urban communities that are absolutely concrete heat jungles where there's not that much tree canopy to cool off. If you have a low resource community, they probably economically they hesitate to do things like run their air conditioner or run it at the minimum, but it's just so hot, they're not going to be active outside. Isolation begins to occur and communities become disjointed, and social cohesion in which activities people would be more active, that begins to break down. Then we begin to look at treatment, diagnosis and treatment. Well, little known fact, maybe not to our audience, but factors that impact climate change also are the same factors that impact pandemics. And so we can see some resemblance about patient care when we look at what happened during the pandemic. People are less likely to make their follow-up care during torrential rains, when access becomes challenging and barriers present themselves. During upheavals, when there's food instabilities in areas that are suffering from drought. Things like follow-up care and showing up for treatment become much more difficult. And all the way through survivorship and into areas like end of life. I've had nurses who have worked in home hospice who have not been able to get to their patients. And there's that alone is horrific, but there's a kind of moral distress that comes from that, from the side of the clinician and from the side of the patients. So it's a multi-layered, complex situation that can't be summed up in one sentence, but it absolutely impacts patient care at every level and at every stage.